Today I have with me Sivaranjini and we're going to talk about PCOS slash PCOD. Now I have Sivaranjini with me on this episode and not a gynecologist, which usually people see on PCOS related talks and interviews. Is because I love Sivaranjini's story, and this is all about stories.
The next couple of days later, that ended up in a miscarriage. I started spotting and then I ended up having a miscarriage. Couple months ago, I lost my father in March and this miscarriage happened in September. A couple of years ago, before that incident, my mother had tongue cancer stage 4 as well. The very next month, I got pregnant. That was a natural conception.
This is fantastic information. Why isn't this part of school curriculum?
It should be.
Can you give us an overview of what is the conventional treatment options that are there for a girl that's coming up with this issue compared to what is the kind of work that happens in holistic healing when it comes to PCOS? So now I have a rapid fire round. Okay, I have some PCOS related quick questions for which I'm going to get quick answers from you. How do we lower testosterone naturally?
Based on the growth of the follicle, your body secretes cervix mucus of different consistencies.
I think we need to be open to all these new things, all these alternate methods also, because for a person that for which method A might not work, method B might work. Hello and welcome to yet another episode of Stories with Maya Zama with your host Swati Jagdish. Today I have with me Sivaranjini and we're going to talk about PCOS slash PCOD.
Yes.
Yeah. So this is a issue that I think a lot of women are going through, no? Oh my goodness, and many years back, to be very honest, no, even in my young adulthood days, I haven't heard so much about it. But now I'm hearing so much about it, and I'm sure the same shock reaction is there for all of you watching or listening to the podcast. Why are so many women going through it? What is the actual solution for PCOS slash PCOD? Let's use just PCOS for this.
Yeah.
Yes,
Just anyone.
PCOS.
Yes.
What are the different kind of treatment modalities that are available? Is weight loss the only solution? There are so many questions that a lot of people have. Now, I have Sivaranjini with me on this episode and not a gynecologist, which usually people see on PCOS related talks and interviews, is because I love Sivaranjini's story. And this is all about stories. Yeah, so adanala I have Sivaranjini because her story was very interesting to me, and she also deals with a lot of my clients who are struggling with PCOS. And I'm enjoying their stories also after they come to you. So let's hear about your story first of all.
Okay.
What is your story of PCOS?
Right. Thank you so much for having me here, and I'm very glad to share my part of my of PCOD or PCOS journey.
Okay.
And mine started back in 2017. So I got married in 2016.
Okay.
Until then, my periods was all fine. So no pain in my periods, or I usually have somewhere around 30 to 33 days cycle. It was pretty good.
Okay.
Nothing to complain as such.
Okay.
But my sister, she had a lot of struggles in terms of periods. So if she's going to get a period, then again, she has to take a pill after a couple of months to bring in a period. And then she would just hug her pillow and then she just lies on her bed. She has intense pain. And there was a lot of complications for her in terms of periods. And it did not rectify for a very long time. But at that point of time, I felt like, okay, I'm grateful that I don't have any period pain as such, because you hear a lot of complaints about that. And in 2016, after I got married, I shifted to Coimbatore. And then in 2017, we thought of starting a family. And that's when I visited my mother-in-law's friend who was a gynecologist.
Okay.
And when I visited her, she told, let us check for just have a basic checkup. We'll have a scan done. And then you come back to me, we'll see what it is. My periods were still the same, like 35 days or so. But in the scan, they mentioned that there is some follicle development, and there is a the condition for PCOS is that should be follicles arranged like a string of pearls is what they say. So it's mentioned that they have multiple follicles, and then that was the very first time I'm hearing about PCOS as well. She mentioned the word neer katti in Tamil. Okay, so it was like, oh, is it very serious?
Okay.
And I said, no, it's not very serious. It's fairly common among young women now. And you need not worry. We'll start a medication for you to bring your periods back in track.
Okay.
Then I said, okay, let me start it. I had no clue about what those medications were.
Okay.
And then she just gave me 3 months, you take this pill. This is a vitamin medication. You just go. And I went back home. And only then I found out that they were oral contraceptive pills, which I was given to regulate my periods, to bring them back. Now, the what happened with the medications was that my body did not respond the way it should have responded to the medication. And then it triggered in a negative way. And then I started gaining a lot of weight post this treatment line. So this mode of medication did not work well for me.
This means you started gaining weight.
I gained weight.
Okay.
I ended up having depression. And I was like very low. My energy levels were completely down. I used to have a very loud energy before.
And how will you make a baby with all of that, no?
Yeah, not possible, right? I did not have no idea on how these things can be handled at that point of time as well. Because my only mode of contact was, again, that auntie to whom I reached out and said, okay, I feel all these things as a major change and I'm not able to work. But at that time, I was the cake decorator. Okay, so I used to have that as a career at that point of time. And I used to wake up, I have to stand for a very long time. I need to have a lot of energy to do those work. I did not have that. And there was zero energy to make baby as well. Because every time there was zero libido at that point.
Obviously, even if things are fine, a lot of people are not able to have sex.
Yes.
With all these things, how will people make babies? Yeah.
No, it wasn't possible. And then she told, okay, this method is not working well for you. Then let's go down the second method, which is changing the drug. And let's do a follicular cycle. And the scans and everything we will see, we'll monitor you. They did that for 6-7 cycles. And again, a part of it was with the medications. And then a part was that, okay, you're not responding to the medication. Let us switch over to injections. And then we went down to injection. And after the injection, again, I did not respond well to it. And then my gynaec was like, okay, let's stop at this point. Now, are you in a hurry for baby? And then I was like, I was really frustrated because this wasn't working out for me.
Your confidence will also
It was
get
all
affected,
gone.
no?
Yeah. And then she told, okay, then let's try an IUI.
Okay.
And only down after we were done with like 4-5 cycles of follicular study, induction with the medicines and all these things, only then she was like, okay, let us do a test for your husband and see. And then we took a sperm test for him. And then he used to travel a lot in bike at that point of time. And he has a very intense heat body as well.
Okay.
So obviously his sperm tests were a bit low in terms of value. And only then she started increasing the dosages for him in terms of vitamins and all these things.
Okay.
And then that went for a couple of months. And then we did an IUI. So the IUI was a failure. We had very high hopes at that point of time, but then the IUI was a failure. And then again I was like, okay, done and dusted. Let me just take a break. And when that moment when I decided, okay, let me take a break, let me clean my body first, because there's been a lot of medication that has gone into it. Let me give a break for the body to process it and push it out and all these things. And the very next month I got pregnant. That was a natural conception.
Okay. But did you do anything to detox or?
Nothing pretty much. But the next month, nothing pretty. I did not know, honestly speaking, I did not know anything at that point of time. All I knew was that, okay, I should do some kind of exercises. So I started walking. I just did plain walking. And the next month I got pregnant. And I was like, okay, yeah, Charlie, 8 weeks or something, we confirmed the pregnancy. And then my gynaec was also, okay, good, it's all fine. Then she told me, let's start with HCG injections for you to just make sure that the pregnancy gets viable. And after that, the next couple of days later, that ended up in a miscarriage. I started spotting and then I ended up having a miscarriage. There was the devastated day in my life because a couple months ago, I lost my father in March and this miscarriage happened in September. So obviously at that point of time, I was like, Pave is coming back to me. I had that kind of a thought and I developed a lot of attachment towards that pregnancy as well.
Okay.
Because after a long time, we are getting pregnant and all these things.
Mm.
And that ended up in a miscarriage. And I was like, I'm just giving a break for everything. I was like, do not ask me about pregnancy here after. And I told my husband the same. I like, we are not planning for another pregnancy until and unless I identify this.
Yeah.
What is actually happening with me? I don't understand. I don't understand myself. And since I also lost my father to a cardiac arrest, and it happened in just a matter of hours.
Okay.
I spoke to him at 10 o'clock. 12 o'clock, I get a call that he's no more. And we were actually pretty close with my father and we couldn't take it.
Yeah.
And I was still processing that grief. Along with the grief, the depression and all these things together, it eventually made me a whole different person. And I was like, I need answers now. I need what is actually happening. Let go of PCOS. Why did my father had a sudden cardiac arrest? Not only my father, another family friend. My father was 65 when he passed away. Another family friend, he was 33. And just like 2 weeks later to my father, he also had the same history of my father of breathlessness, and then he fell and then he passed away of cardiac arrest as well. Then there is something missing. What are we missing here? And at that point of time, I changed my gynecologist as well. And she, I think that was somewhere around October. And she said, you need to focus on your food. Okay. Then it was like, I grew up in a family where everything had a pill solution. Okay, so that's how my father had. His ideology was that. And that man used to take 32 pills a day. No kidding. 32 pills, like 11 in the morning, 12 in the noon, and then another 13 in the night. We used to make packets of all the medications for him because he had so many complications. So genetically, I'm not blessed with a very good health as well. And a couple of years ago, before that incident, my mother had tongue cancer stage 4 as well. So when you take the history of my father and mother, I had the possibility of getting everything under the sun. So then I thought, okay, I need to do something because I cannot go back in the same line that those two people went. And that's when nutrition came into place. And I started learning more about nutrition at that point of time. And I felt like this may not be sufficient. I need to enhance my skills as well in terms of nutrition. And I ended up being a nutritionist, a holistic nutritionist, because that gave me a better idea of what is actually happening in the body. And one by one, I started learning more on all these things. And just 2 months down the line, I think it was December, my old gynecologist, she actually told me after the miscarriage, she told me, okay, if this is not working, let's go for IVF. And I told that was the point for me, like, no, I need a break. Okay. Let me work on this and come. If still IVF is going to be the way for me to get a baby, let's be. But I need to work on myself. And my new gynecologist, she started with the same thing. Let's do a follicular study. Let's understand what your body is trying to say. But she put me on just vitamin medications and everything. But at that point, I honestly did not pay attention much to the medications and everything. But I focused more on the nutrition part. So I worked on the diet. I did a bit of walking, just these things. Lost a couple of inches and kgs as well. And by January, I got pregnant again. It was a natural conception too. And that is my son now. So that guy's journey towards me is the reason I am sitting here in front of you. But my answer to all the questions I had wasn't fulfilled. So I started learning more and more and more and more. And it's been 5 years now. And I've completed 32 certifications in hormones, nutrition, different types of nutritions like Chinese nutrition. And
I like how you talk about traditional Chinese medicine all the time, TCM.
Yeah, it's very interesting.
Yeah, we have to have another session exclusively for TCM. It's a very fascinating field, I think, like Ayurveda. Because it's many centuries old.
Yes.
Very, very interesting.
And the good thing about TCM is that they have a lot of proof as well because they couldn't let go of their tradition. So they worked on a lot of research papers too. So you have a lot of proof.
We will talk about all these one by one.
Yes.
And one more thing I'd like to interject here slightly, Sivi. This is also for participants, we somehow learn more when we go through certain things instead of at a college degree at 17, 18, 19, right?
Yes.
That's something I've also realized, just because we didn't take a particular course in college doesn't mean we can't study about it later.
Yes.
And also our ability to absorb that knowledge or to think beyond textbooks, that happens once we go through certain life experiences, and that gets us to certain information, knowledge, courses, certifications, etc. I think that is another thing that people have to explore.
Yes.
Just because you didn't study something back in college doesn't mean you can't learn about it at 23 or 25 or 30. Learning never stops.
Yes.
Yeah.
There is a lot of unlearning too. More than learning, there is a lot of unlearning too. And we do still invest a lot of energy in terms of learning. Let go of the money, but we still invest a lot of energy. There is a lot of brain work that goes when you learn about certain things. And even like you mentioned, even if there is something out coming from the textbook, you just don't immediately apply it, right? So you need to have some logical connections. Sometimes experience also helps. Sometimes talking with different people, gathering their experience, that also matters a lot, right? Yeah.
So yes, so that has been the story. Now I haven't heard of all the intricate details. I just know the overall story. So that's why I was getting shocked in between with all the little details.
Okay.
But coming back to our topic, can you just quickly go through the genetic link that PCOS has, or what is PCOS for layman to understand? Right?
So when it comes to categories of PCOS, that conventional medicine has it like 4 different types now, A, B, C, D now.
Okay.
But functional medicine had it before in terms of like adrenal inflammation, or you have this insulin resistance and post-pill PCOS as well. Okay. So there are 4 types of PCOS. How do you know if you having a PCOS apnea? There is something called as Rotterdam criteria. So where they say either you need to have irregular periods or an ovulation should happen. And you should have this pearl-like structure in your ovaries with the follicles. And the third condition is that you need to have hyperandrogenism, meaning lots of testosterone, or hirsutism, as like the mush and the beard that grows, hair in your chest and nipples, and even in your stomach, all these things. Okay, so all these 3 are criteria. If you have any 2 out of 3, then you can also categorize yourself under PCOS. Apart from that, you have other 4 criteria, like I mentioned, inflammation. What is actually causing the PCOS here? Is it inflammation? Is it adrenal? Or is it insulin resistant? Or is it because of stopping an OCP as well? So again, they are also planning to change the name, which is metabolic reproduction disease, I guess. So disease or syndrome, something of that sort. Yeah. So I mean, it's still under consideration because there's a lot of confusion with PCOS, right? So what resonates, what makes easier to understand is that you need to have at least 2 of the following conditions. One is either you have the cyst formation in your ovary, or you have high androgens, which is the high testosterone or DHEA, or you tend to have insulin resistance as well. So if you fit in any of these 2, then there is a chance that you have PCOS. Genetic marker is basically, I come from an androgen dominant body, like family. Meaning, if you look at my aunts from my paternal side, when you look at them itself, you get this strong masculine energy from them. And all of them, they have excessive body hairs. And meaning that has passed over to me. And if you have diabetes in your family running through, there is a higher chance that you might be prone for PCOS. Okay, so you might have dark neck popping up from time to time. My sister had that at the time of her puberty. She had dark neck. And she gained a lot of weight. When she attained puberty, we had no idea. I mean, PCOS wasn't even a topic at that point of time, I believe. And later, only in the later stages, when we checked with the dermatologist, she told us, okay, if your father has sugar, then there is a chance that you might get the neck darkening. But internally, so there's a higher chance that you might get. So what I do for my daughter is that I need to watch her sugar intake really very carefully because I had PCOS.
Yes,
My father had a very pathetic
So many
yes,
issues.
yes.
Chronic condition.
My mother-in-law, she had PCOS as well. So she had struggles to get pregnant, and after a long struggle only, she also got pregnant. So I need to be really very careful when I monitor my child. Because she's prone to that. She may not get it, but she is more aligned towards this kind of family trait.
All right.
So I need to do that. Yeah.
You did mention the kind of treatments that you were put through, right? Can you give us an overview of what is the conventional treatment options that are there for a girl that's coming up with this issue compared to what is the kind of work that happens in holistic healing when it comes to PCOS or the work that you do?
Okay, right. I want to add one thing. I'm not a replacement for a gynecologist.
Everybody has their role
Yes,
in
my role,
the drama.
yes. My role here is to make sure that you have a proper lifestyle, diet, and in the recent times, energy as well. Because all these three things matter to get this overall thing. Because most of them, when they address me, they're like, can you prescribe me this medication? No, I'm not eligible to do that.
Yeah.
I can't do that. But I can just guide you on what can be done and what you can ask your care provider about this. Right. So when it comes to the conventional methods, the first step would be to do a follicular study to understand if you're really ovulating or not.
Okay.
Because one of the major struggles for PCOS is that you don't ovulate or you ovulate very late. Okay, like 45 days, 50 days. Or you don't ovulate at all. Okay, that's the major struggle with PCOS. And when you're not ovulating, what actually happens is that you don't get progesterone in your body. So there is no hormone balancing. And there is excessive testosterone building up in the body. So your body thinks that, okay, she has too much of testosterone. Probably she is extremely stressed about something, or there is some kind of hormonal changes happening for some reason. Let me halt the reproductive process. So the attempts to get pregnant can be stalled.
Okay.
Now, what they do is they put under medication. So they can put you under insulin medications to just control the blood sugar spikes and everything.
Okay.
And then the next step would be to try to regulate the periods if at all possible. By controlling the sugar itself, sometimes you'll be able to do that. And the next step, if these are not working, then injection types comes in. And if the injection types are not going to work, then in case if you're planning a baby, then it would be IUI. And if that fails, then IVF as well.
Okay.
Now, this is the convention method that goes. Many get positive results in this as well.
Okay.
But when you come to the holistic aspect, the very first thing we work is on your diet. So we work on getting the sugar levels down in your body. Try to make sure that your body is not having continuous spikes or it is not responding in a negative way.
Okay.
So you work on your diet by making it a low carb. So there is again a confusion here. Most of them go for no carb. No carb is not the solution. You need to go for low carb, good quality carbohydrates, protein and fats as well. So fat is again one of the most misunderstood thing when it comes to hormones. That is the building block for your hormones. So immediately when they're trying to lose weight in terms of PCOS, right, they immediately go for either they do excessive exercises. That is not going to help. Or they cut down the fats, the good fats along with it. That is not going to help because only when you have good fats, you're making cholesterol, which is going to make hormones in the place, right? So you need to work on your diet first. The next one comes the lifestyle, where proper sleep or a proper set of exercises that you need to do. What type of exercises at what stages?
I'm going to ask about it.
That's also important. And after that, your energy levels. When we work on the energy levels, I see a drastic change.
Okay.
Your energy is impacted through your past trauma as well. So when you work on your emotional blockages or your trauma, all these things starts to align. And then they will be able to get a better result. Most importantly, they understand their body. Rather than a third person commenting on, okay, this is what is happening, you need to do this to get this sorted. They will have an understanding about their body. Okay, this is happening. I'm aware of this. That is also very important.
Yeah, because only then they will make those changes. Instead somebody is telling you, do this, do that. No, you might not do it. Instead, when you understand, oh, this is wrong, I need to correct this. So then that autonomy plays out and then they actually do those so-called lifestyle changes, right?
They take interest as well in doing it because they need the result, right?
Yeah.
So when they have better understanding, the better.
Yeah, because when you know more about your body, you're more empowered to take those decisions also. Instead of somebody else telling you something and you feeling disempowered, it's very important that we make our clients empowered to take their own decisions.
Yes.
That brings me to this. A lot of participants of my workshops, when they come for your classes and they come back with the feedbacks, they're like, I already started off with infertility treatments and all of that, and I thought I was infertile for some reason, and they couldn't even find the reason. They said no reason infertility and all of that, but my gut feeling kept telling me that there will be some reason, and then I did this, and then I made all these changes, and now I'm pregnant. And many people, they talk about trying to conceive when they thought they were ovulating, but they were not actually ovulating.
Yes.
But then when they did the fertility awareness method and the charting method and everything, they could identify that they were ovulating at a different time.
Yes.
Tell me something about that.
That is something that I stumbled upon when I was trying to avoid a pregnancy after my son.
Okay.
And it was really very interesting for me because your body is giving you inputs, right? So you can read your body to get those inputs. And I felt like, okay, for people who want to get pregnant, this is much more easier for them to track themselves and they can plan it, right? Because for most of them, they tell that 14th day, you go have your intercourse, you'll get pregnant. Then they do it and then they come back and like, no, right? So there are, again, a lot of factors that involves in it. If you're hyperly stressed, if you're having inflammation response in your body, that is a higher chance your body is trying to say, hey, I'm trying to protect you, don't do anything because you're not ready for a baby, because you may not be able to support a baby. That's the response the body is giving. If liver has a function, the only function a uterus is going to have is make babies, right? So if it doesn't feel safe to make a baby, then it won't. But we need to understand that as well. Now, through charting, we take inputs from the body like the cervix mucus, like with the growth of the follicle, right? You will be able to, which is happening in the ovary. So the follicle grows around 2 centimeters and then it breaks and the egg releases. Now, based on the growth of the follicle, your body secretes cervix mucus of different consistencies. So there are 4 types of consistencies. When you understand that, the topmost consistency is the egg white consistency that you might say. When you get that, it means you're about to ovulate. And when you plan your intercourses based on that, you will be able to click a pregnancy much faster.
And you will teach them to check their
VBTS, yes, temperature. That is to compare, you need to compare your cervix mucus along with the temperature.
So, where is it matching?
Yes, because you have progesterone, which is a heat-inducing hormone in your body. So by default, when there is a surge of progesterone, you find excessive heat in the body. So your temperatures go up, by which you can confirm there is a ovulation has happened. So through this process, they can identify the days they need to have an intercourse. It's not mandatory that you will have on day 14th. You can even ovulate on day 25 based on different circumstances. So if you identify that, you can have your intercourses on that and still get pregnant. So what they think is that if I don't get an ovulation on day 14, I'm not going to get pregnant. No, that's not the case. For me, the very first pregnancy, right, I had ovulated like 2 weeks later. But still I was able to get pregnant and that is my son. And for my daughter, again, there was a 1 week delay. I was still able to track that. I found the egg white consistency and we planned accordingly and she is here as well. So it's actually pretty easy to understand these inputs from your body.
This is fantastic information. Why isn't this part of school curriculum?
It should be. It should be. Yes. I mean, it's just 4 hours of lecture of this, but it's very easy to understand. This is a life skill, I would say.
This will be one of the first things that I'll be teaching Maya will be this.
Yes.
For sure.
Yes.
Every girl should know this. Period.
Definitely.
Period.
They should. They should.
Yeah.
Because this is the basics for them to understand themselves. When we speak about empowering, you need to empower yourself through your understand through your body first, right? You should know that.
Now, Sivi, another aspect that I talk about in my workshops is about the masculine and the feminine energy, about the yin and yang in everybody, and how we are trying to balance it out, how sometimes it won't be in balance, and how in certain activities it will be yin more, in certain activities it will be yang more, and in all of that, I have a session called Inner Balance where I talk about it. In between the sheets also sometimes I talk about it. And that, I think, is a concept, again, that everybody should know, because that is also directly connected to
Yes.
PCOS, right?
Yes.
So can you just connect both with PCOS?
Okay, so this again comes from Chinese medicine. Okay, so you have this yin energy and yang energy. So yang is pretty loud. That is termed as the masculine energy. Yin is the feminine energy. It is very subtle and gentle.
Everybody thinks yang means being masculine, and yin means wearing a sari and being very feminine. That is not masculine, feminine people.
Yeah, men also should have this in balance.
Yeah,
Yin and yang.
they should have their own yin.
Yes.
Women also should have their own yang. Yeah,
Yes.
this is a very different concept than wearing sari and puttu and being feminine. That's not it.
Yes.
Okay. Yeah.
It's never that.
Yeah.
One other thing that need to understand is that yang is connected to the liver, yin is connected to the kidneys. Okay. So in the conventional medicine, what we see is that it's just the uterus, right? So, and then endocrinology abdina, then we go to another doctor. We need to work as a multi-speciality there. But when it comes to the other methods, right, it is seen as a whole perspective.
Yeah.
So one thing that actually was like, wow, அப்படின்ற ஒரு இது இருந்துச்சுன்னா, it was like, you need more kidney essence to make a baby. You need more yin energy to make a baby. Be it a guy or a girl, it's the same.
Okay.
So you need more yin energy. That determines your fertile aspect as well, right? So when you are moving towards the yang energy, okay, so there is so much of anger, there is frustration, or a few things can be like, you need to step up to a masculine role where you draw in a lot of stress towards you, right? That by default increases the stress, and when you increase the stress, you also increase your testosterone. There are studies on this.
Absolutely.
So when there is increase in testosterone, obviously you tend to have PCOS. Yes. So this is the energy aspects. So when you're working to bring PCOS under control, it is also important to build the yin energy in as well. Okay, so trying to incorporate the tools that can help you to reduce the stress and all these things. So testosterone can be managed through a little bit of a diet and all these things. But the main aspect is that how will you control your emotions? How can you control your anger?
Which is like not taught in any school.
It is not.
Today only we are trying to figure it out.
Yes. So because when there is so much of anger and frustration, your liver tends to heat up even more, right? So when the liver is heating up more, it is not going to function efficiently in terms of whatever it is supposed to do in terms of hormones. So it needs to metabolize the hormones and push it out, and that is not being done. So we call this as liver stagnation. Okay. So what we do is, so my method actually involves one other practice where we try to get the stagnation out from the body, a liver stagnation as well. So this again comes from that Chinese medicine. So once the stagnation is removed, and once we try to increase the essence of the kidney, so by which you increase your yin factor, you will be able to nourish yourself better, is what they say, because yin is nothing but nourishment. So, and it's the same for men. So you need to bring down and bring it to a balance as well. And when things happen in such a way, the chances for you to get pregnant is really very easy.
Yeah,
I would say.
But those are the stories that I'm getting to hear from people. You know, they try the conventional methods, the mainstream methods, and then they are fed up and frustrated, and they're disempowered, and they feel like a failure, and they feel guilty and regretful about why their body is not cooperating, and they go through hell and depression and everything, and then they find these holistic methods or alternate methods or unconventional methods, and they try different little things, and they're happy. They're happier. That's what we all need at the end of the day. No?
Yes. You need the results.
Yeah, I'm happy. I'm feeling much more fulfilled doing this.
Yes.
I feel it's working. I can feel it's working. If somebody else is not able to see it, it's not my problem.
Yes.
But if it's working for me, then why? Why not? I want to try it. And I think we need to be open to all these new things, all these alternate methods also, because for a person that for which method A might not work, method B might work.
Yes.
Right.
On this, I would like to share one thing. So there is a book called as Evolutionary Herbalism. So as a part of whatever I'm doing, I learn a bit of herbalism as well. And that book actually speaks on a fact that based on your zodiac sign, which is nothing but you are born in a particular season, right? So what they say is a particular plant, the leaf will work for a certain zodiac signs. The flower will work for particular signs. The root will work for particular signs. Meaning, every individual will have a different approach. So who are, part A, which is like who are responsive. Who can be treated with the root cannot be treated with the flower, right? So the vice versa as well. So one approach doesn't work here, and so you need to work out a little bit up and down in terms of understanding yourself to understand where you actually fit in here.
Because even psychosomatically also, something that is affecting you psychologically can affect your organs is something that mainstream medicine does not really deal with.
Yes.
And I think that is something that we need to accept.
Yes.
Certain schools of thought will only deal with certain things. And it will be some other school of thought might be dealing with something else. Maybe you have to bring both together.
Yes.
That's how you create these multidisciplinary approaches, and everybody can contribute what they know well, and it can all come together into a beautiful amalgamation of a beautiful healing technique.
Yes.
So nobody is less, nobody is more. Everybody has their own role to play in the picture is what I strongly believe. So now I have a rapid fire round. Okay, I have some PCOS related quick questions for which I'm going to get quick answers from you.
Okay.
So everywhere a PCOS candidate goes, the first thing she gets to hear is lose weight.
Yes.
Yeah. Even if it's a comparatively average looking person, the first comment would be to lose weight. Now, cardio doesn't help with PCOS. If so, what are people supposed to do?
Okay. So actually it doesn't help.
Okay.
Especially the HIIT method that they do, right? High intensity interval training.
Yeah.
That is not really very supportive for PCOS.
Okay.
So what it'll actually do is that it increases your stress levels, and that will increase your testosterone as well. Okay, which is not going to help you.
Yeah.
Whereas you can try doing more of strength training, yoga, and more of restorative yoga, which is also called as yin yoga.
Okay.
And low impact cardio exercises like walking or swimming or cycling. All these things can be of a good fit. It also reduces weight. And at the same time, it also brings insulin under control as well. Okay. So you might feel like you're losing weight with the HIIT and all these things. But once you stop it, right, it's just going to surge back a lot. So that's one reason many feel like, when I go to the gym and I do all these things, I reduce weight. But after that, instantly I gain all the weight back. So that's primarily because they're not doing it in the right way as per their body. When I say as per their body, you are aligned to do all these kinds of high impact cardio exercises only during your ovulatory phase. Other phases don't support in terms of hormones. So the other phases, it's just like more of very subtle types, strength training and everything. The only time where your body can support a high interval training is only during the ovulation phase.
Okay.
Yeah. That is about the cycle syncing and all these things.
I think we'll have to do a separate
session for cycle syncing. Yeah.
Okay. Again, coming back to the nutrition point that you said, low carb, no carb, all of those things, and how does diet actually help PCOS? And there's this thing about protein causing gut issues also.
Yes.
Too much of protein. Suddenly taking protein. Yeah.
Yes.
Your comments on that.
So the first thing is that many of them opt for no carb, no fat, which is not going to help.
Okay.
You need carbohydrates for your body. So you need to take it, but the quality of the carbohydrates need to change. Meaning you take more complex carbohydrates than the simple carbohydrates.
Yeah.
And the second thing is protein. The problem what people do with protein is that they don't cook it right. Okay, so what do I mean by cooking right is that, see, if your gut is already impaired, it is not going to take the load of protein. Okay, and immediately they end up being gassy or bloated, or they get constipated. Okay, so what you need to do is you cook the proteins in a right way. For example, all the lentils and pulses, they need to be soaked, sprouted, and even if it is sprouted, you need to cook the sprouts and eat. Okay, because that makes the load on your body a little easier. So, and mindful eating is also important. You need to chew a lot. So when you chew a lot, it gives the signal to your body, okay, this is coming inside. Let me help in getting it absorbed. Right? So major digestion happens in the mouths, and we don't eat slow. We like
in every way just be in.
Yes.
Very slow,
calm.
Yeah. I'm sure there's a lot more.
Yeah.
Classes and all, you can do that. For this, now we need this much.
And fat is important, of course, because that's the building block for your hormones. Just like how protein is for muscle, fat is for hormones. So you need that.
Right. Yeah. Right. What are some of the major nutrients needed for PCOS management?
Okay, so if at all you're put under any medication, just monitor your vitamins in terms of B12 and D. Okay, so sometimes there can be a depletion because of the conventional medications. In case of anything happens like that, then you take extra supplements to just match up that. That is one thing. The most important one is vitamin B12, okay? Because there is a higher chance for cardiac issues for people who have PCOS in the later stages. Okay, so when you don't have enough amount of B12,
I'm just taking some time to just empathize with all the PCOS people, no?
I know. They are the shit warriors, man.
Warriors, yes, I agree, but it's so tiring to go through it, no? Actually,
many actually ask me, okay, I'm doing all these things. Will PCOS go? Okay. Now the problem we need to understand is
that question also.
You have that. Okay. Then I'll finish this and come.
Okay.
So I was telling about B12.
Yeah.
Right. So vitamin B12 is important. Vitamin D is very important. All of us are deficient in vitamin D some way or the other. And vitamin B12 is equally important. And B12, what it does, it reduces something called as homocysteine in the body. Okay. And there is too much of homocysteine, the chances for you to get a cardiac issue is also really very high.
Okay.
So you need to work on that most prominently. Magnesium is the most underrated mineral ever. And then you have the zinc. Okay. So all these things are equally important.
Basically,
but these are all needed in extra amounts. So when you have all these things, it makes life
the body
a
is going to do its job.
Yes.
Yeah. Okay. People are struggling to get pregnant. What are your comments? Because it's difficult, no?
Yeah. So that is one thing that I want to say. Don't be fixed with one particular mode of getting pregnant.
Okay.
That is something that I see in practice.
Like be open
to everything. Okay. So it's very similar to how you deliver, right? So it can be vaginal or it can be a C-section based on the conditions.
Yeah.
So it can be anything here.
Take the help of science and technology for that.
Exactly. Take the help of modern medicine for that. Because they do have certain tools. But it's just that when you go on an integrative approach, it's much easier for you to just get hold of the results.
Also, when your mind opens up, you calm down a bit more.
Yes, you don't stress a lot. Yes. So whatever method you're opting, be it natural or the ART methods, whatever it is going to be, make sure that you prepare your body for that. That is the most important thing, and many people miss in that. 2 to 3 months of proper diet, proper lifestyle, all these things are important to enhance the quality of the sperm and the egg. Okay, it's like 50-50. You need both the hands to clap here. So you need to work on both the sides. So the conception becomes more healthier conception. Or if you're even going for IVF process or anything, or now you have egg freezing and all, right? So if you're going to opt for any of those things, again, the quality is very important.
It does, yeah.
So when you work on the quality for at least 2 to 3 months, okay, max to max 4 months, you can just change your body to a certain level. Right?
And maybe you might just get conceived of
naturally as well. So that preparation is very, very important. Okay, you just don't go plant something and then you just wait for it to bloom. Right? You need to give the right nutrients, you pour water, you give the sunlight, all these things. That's the preparation that you need to do. So you need to work in such a way that the chances to get pregnant it gets easier no matter the type of thing you're going to opt for.
Yes. How do we lower testosterone naturally?
Okay, so one is being very mindful of your emotions. Okay, so through practice, what I see is that lot of anger, lot of frustration. And I also see that people who have PCOS, they also might have trust issues. They can't trust other people, or they tend to be perfectionist. Okay, they're like, no. Even if you're going to do something, like, I'll do it a little bit better. Okay, then they start investing their energy more in that. And by default, if you're in a higher position, you need to have that dominance in you to get the work done under you. So those are all traits that can push a little up. So being mindful of your emotions is very important. Through that, you'll be able to reduce it. And the second thing is that there are actually researches coming up in terms of natural methods. Stress reduction, like in terms of breathing and all these things can be done. You also have spearmint tea, which is still emerging in terms of researches.
Okay.
You can still use that. You have avarampu. You can make a tea out of that flower.
Okay.
And that actually helps with insulin resistance. There is enough research for that too. You can add all these things along with whatever treatment you're going through and your diet routine as well. Yeah. So these things you can do
Basically, again, bring your body into yin mode.
in mode. Yeah. The more calm you feel, like it's like whatever happens outside, I'll be calm, right?
Roll the flow.
Yeah, that attitude is something that you develop, and I feel that you develop after you're hit really very hard by life. And you're like, yeah, amma aachu, what to do, what next,
Yeah.
right?
Yeah.
So I think this is something that I'm learning now. Whatever happens, the question is that yeah, it happened. So what? What do I do next?
Yeah.
So that approach
Not
can
taking
actually
up too much of stress, not taking everything personally.
not overthinking.
Absolutely. Having the right boundaries in the right place. Even telling boundaries in the sense, I always say boundaries is not only about what you can do in that situation. It's also about what you can't do.
Yes.
Say can't do. Can you please help me?
Yeah.
What is wrong in asking that? So I think combination of all these things can, when it gets your body into a different mode,
Yes.
these things might work out automatically for many people.
Yes.
Now I have a myth busting session.
Yes.
Okay, so you tell me if it's a truth or false. Okay. True or false. Myth or fact. Women with PCOS have to be overweight.
No.
Yeah. You spoke about
it's a
lean
myth.
PCOS.
Yes, lean
now.
PCOS is also there.
Yeah.
It's a myth.
PCOS affects about 10% of women of reproductive age.
That is a fact.
Fact.
Yes.
10%.
1 out of 3, they actually.
Okay. Oh, I was thinking more. Huh? It's 10 only. It's good. But with the way that we are taking up life and stress, it can be even worse.
See, I do this bark flower remedy now. Okay. So I give them a questionnaire and I ask them, what are your top issues happening at this moment, what is actually happening? 75% of them, they had overthinking issues. Okay. Or the next top thing was anxiety. And the next thing was that they were not able to say no. These 3 are the top issues actually our current generation is undergoing. And those things have a very strong impact on how you behave as
all
well.
building stress and cortisol and everything. Yeah. Birth control pills cure PCOS.
No.
We just spoke about it.
No, yeah.
PCOS is one of the leading causes of infertility.
In a way, yes. Yeah. Because you're not ovulating, right? You can make babies only when you're ovulating. Yeah.
Women with regular periods cannot have PCOS.
Not ideally. If you're still having more testosterone, by the criteria, you still fall under PCOS as well.
Okay.
You can still ovulate. Probably your cycles are a bit longer. But you can still, when you understand that when you're ovulating, even if it's going to be on the longer side, if you can target those days, you can still get pregnant.
Yeah. Lifestyle changes can significantly improve PCOS symptoms.
Definitely, yes. I'm a living truth for that. Yeah.
Weight loss alone can cure PCOS.
It can be a part of it, but not necessarily just
Not
that.
alone.
Yeah.
Women with PCOS have higher risks of developing type 2 diabetes.
Definitely, yes.
PCOS is caused by eating too much sugar.
Not ideally, not just that. It can also be your stress.
Yeah. High levels of androgens are a hallmark of PCOS.
Yes.
You can't manage PCOS symptoms without medication.
You can, but depends on where you are
in your journey.
Yes. If it's too strong, if you're too long into it, then probably you need some kind of medical intervention to get it straight.
High stress can elevate cortisol, potentially worsening hormonal imbalances in PCOS.
100%.
Yes.
Yeah.
So I think that's it.
Cool.
Thank you so much for all that information. And a part of it I already knew because of the work that you do. I know the work that you do and the amazing feedbacks and testimonials from people. We are getting to see it every day. You have to give a closing note for women like you.
Okay.
Who are in the 10% category who have PCOS. There might be even people who might not know they are having PCOS. But what are some of the things that they can check now or be aware of so that they don't end up with PCOS? And certain words to the ones that are struggling with PCOS.
Have a good connection with your periods. Look at the color, how much you bleed in a cycle. All these things give potential information on what is actually happening in your body. So that is one thing you need to know. Second thing is that start loving yourself. if you have PCOS, yes, you have, but what can you do about it? It should be the next thought, right? But just don't know, oh, I have PCOS, oh, I have PCOS. That's not going to help, because I've been in that journey and it did not help me at all. So understanding, I always keep saying this, the more you learn about your body, the more you understand your body, treat it like your friend, the more input you get from it, because it's constantly giving out a lot of information. Yeah, so we do this face reading, right? So it constantly gives a lot of information. So when you learn those information, you'll be able to take better care of it. And unlearn a lot of things, learn a lot of things as well, because I think most of them, they don't do a lot of unlearning and don't have this and the sheep mentality, like don't have this herd mentality. So if it's working for someone, it doesn't ideally mean it's going to work for you. You need to understand yourself and make a decision on what will work for you. And it is not a huge thing in terms of fertility. You can still bring the PCOS under control and you can get pregnant. So there was a point in my life as well where I felt like you have this overthinking, right? You're like, okay, IUI did not work. I ended up having a miscarriage. Probably I was devastated. I mean, and I thought like, and I'm bound not to have children at all, I guess. Then, okay, and then I was talking to my husband, like, we'll go for adoption and all, okay. And I started thinking, like, things that will not happen only basically comes in your overthinking. But there was also a moment that kept on telling me that, hey, you can get pregnant naturally. And I hold on to that and I started working towards it. You will also have something that you can hold on to. And everything can rest when it comes to pregnancy. I mean, if you're trying for a baby, put everything under hold and take time for yourself, prepare yourself, because that matters the most. Preparation is very, very important. And this has to be done as a couple as well. That is something, again, that is missing, right? You need to do it together. So learn more about yourself. Get whatever is triggering you. You need to understand that why am I getting triggered? Because that has certain kind of impact in your body.
Everything has an impact. Nobody can say this thing is not impacting.
Yes. So learn more about your body. Actually, it is pretty easy to get pregnant if you understand your body. I get smashed for telling this word out, but because there are many people who are struggling. I used to be a struggler as well. So, okay, now I'm here and they people say, you have it, that's why you talk. I work towards it, I have it now. If I was to keep on complaining, probably I'll be lined up somewhere else as well. So you need to understand your body. That's very, very important.
Thank you. Thank you so much for that.
Yes, thank you.
So that's about it, people. I hope you all got whatever you had to get from this conversation. I'm sure there's a lot more information. Medically, there can be other things, since Sivi is dealing with holistic healing and holistic approach. These are the things that Sivi can contribute in terms of understanding of PCOS. Other professionals will have other angles. Me as a mental health professional, I have certain other angles of why people are getting it. Overall, I feel it's a beautiful awakening time for a woman to slow down and stop being hyper-independent and hyper-masculine and use the yang energy wherever it's necessary to be used. But in other places, time to slow down, time to do your inner work, time to do your healing, time to concentrate on the relationship and your intimacy and so many other things. So I think you should take it as a nice opportunity to learn more about your body, learn more about your partner, your relationship. And I'm sure you'll all get pregnant, you'll all have babies and have a beautiful life. Sivi is a living example of how diet and lifestyle can change your life. And seek help wherever you need, and look out for professionals that deal with different angles of an issue if the strategy that you have chosen is not working for you, right?
Yes.
So that's about it. Thank you so much for this beautiful interaction, Sivi. I'll see you in some other episode to learn more about our bodies.
Definitely. Yes. Thank you so much.
Bye-bye, everybody. I'm sending you a lot of love and a lot of healing vibes from Swati and from Sivaranjini. Bye-bye.